Hi, Margie. Very interesting statistics that you presented. I found it shocking that it was 42,000 opioid specific deaths and that the package that you were talking about passed 393 to 8. That is very encouraging that people are recognizing this is such a big problem that deserves a substantial amount of attention. Um, it was staggering that the National Institute on Drug Abuse said that nearly 29% of people who are prescribed opioids misuse them. So that makes it obvious that the addiction frequently does start after a surgery. I really liked that you used orthopedic surgery patients specifically because I work on a med-surg telemetry and orthopedic floor. So pain control is a huge concern for our patients because we often want to promote early ambulation because we know this is how they're going to heal more quickly and heal better. And so, in order to get them up and ambulating and moving around, we know that we have to control their pain effectively, but you don't want to over control it and even increase their risk more of opioid addiction, creating more problems for them. So one thing I will say is that I have been seeing a lot of our ortho patients not having a substantial amount of opioid prescriptions. You're seeing a lot more of the NSAIDs and non-opioids being used to supplement opioids or to also help with breakthrough pain or to use, if the pain is not severe enough, to use opioids. After watching your presentation, I will now be able to discuss peripheral nerve blocks with physicians and patients. The medical team present it as a potential option and see if this is something the physician and patient would be interested for if they were eligible to have, if they were considering surgery. I'll also be able to discuss a lot of those advantages that you presented, which were huge. Things like reducing nausea and vomiting after surgery. This is very common and really does bother patients and hinders their healing process. So that is a big advantage. And also, the main one that they may not even need opioids at all following a peripheral nerve block, that it could completely control their pain after surgery. I thought overall your presentation was outstanding. The article is very interesting, and the peripheral nerve block seems like a great alternative to using opioids to control pain. And I did feel very encouraged with this other statistic that you put in there that the president had set aside $6.7 billion to help fight this epidemic. So I think it is very positive that people realize that this is a big problem, and it sounds like there are many resources being placed aside to help prevent and treat this crisis that we're experiencing. So thank you very much for sharing.